Hi, my name is Dr. Ruchir Patel. I'm a sleep medicine specialist with formal training in sleep medicine with a background in internal medicine, but also special focus in neuromodulation therapies for sleep apnea as well as insomnia, but even mental health. Let's talk about sleep.
This podcast is brought to you by Sip to Sleep. SIP, the number 2, sleep. Sip to Sleep is an all-natural, patent-pending, clinically proven natural sleep aid without melatonin. It contains 2 natural ingredients, tart cherry extract, which has been shown independently in small clinical studies to improve the ability to fall asleep, stay asleep, and sleep longer, but without the natural sugars of the tart cherry juice. And then the second ingredient in Sip to Sleep is Venetron, which is rafuma leaf extract, which comes from Japan. It has been shown independently in clinical studies to improve the brain's ability to enter into stage 3 sleep, which is also known as deep sleep, but also reduces degradation of serotonin in the blood, which is a precursor to melatonin, but also helps to improve mood by virtue of having antidepressant and anti-anxiety effects. Both of these natural ingredients combined together actually help to facilitate increased natural melatonin production and release from our brains, which in turn helps to facilitate sleep. The clinical study that was run on Sip to Sleep, specifically in 2023, showed that greater than 80% of participants that took Sip to Sleep prior to bedtime found that they actually fell asleep faster, slept longer, felt better rested the next day when they woke up in the morning and during the daytime, but they also noted a reduction in next day anxiety as well when they took Sip to Sleep compared to not taking it. So if you're looking for an all-natural sleep aid that does not contain melatonin and does not have the negative long-term effects of prescription sleep aids, try Sip to Sleep. It's formulated by a sleep physician. It's available online at www.sip, the number 2, sleep.com. That's www.siptosleep.com. Hi, Dr. Ruchir Patel here, the Real Sleep Doc. Today I wanted to speak to you about the bidirectional relationship between sleep and mental health. We all know that when an individual doesn't get good quality sleep, that can definitely affect the way they feel the next day with regards to their mood, obviously their energy levels, motivation. But then there's also this other aspect of individuals that may have, mood disorders like depression or anxiety or bipolar disorder that can also affect sleep. So from our standpoint in sleep medicine, but I assume also in psychiatry as well, is that the question always is which came first, the chicken or the egg? Meaning, was it the mood disorder that's developed the sleep issue, or is it the sleep issue that's developed the mood disorder or contributing to the mood disorder rather? And research over the last several years has determined that there actually is a bidirectional relationship, meaning that they're both actually intertwined together. In our sleep clinics, when we meet with patients that come in with complaints of insomnia, we're always kind of triggering and seeing if there are symptoms of depression. Are there symptoms of anxiety? Because we do know that, insomnia can be a defining symptomatic feature of major depressive disorder. Insomnia, difficulty falling asleep, difficulty returning to sleep can be a symptom of anxiety. But the question ends up being is that which one came first? Which one is playing a major role in the other, right? So from our standpoint, we feel that addressing both issues are very important. But from a sleep side, it's also important to note that if a person's not getting enough sleep, they're sleep deprived, by several hours, or even if they're sleep deprived by 1 hour, or if their sleep is very broken, or if they're just not able to get enough sleep, that all greatly impacts how the brain handles emotional stress, which in turn can affect, an individual's mood the next day, whether they have clinical depression or anxiety or they don't, right? I think all of us can relate to the fact that if we haven't slept well, we don't feel as well the next day. We may be more irritable. We may be more anxious. We end up becoming more reactive to stressful situations in a way that we normally wouldn't have been if we were well rested. And that doesn't mean that you have anxiety or you have depression or you're an irritable person or you have anger issues. It's just a manifestation of poor sleep, right? And even I myself personally can attest to if I haven't slept well, I definitely know that I can be more reactive the next day. I could definitely be more anxious, even though I don't have anxiety, even though I don't have, depression, I don't have anger issues, but it's the direct effect of not getting good sleep. So in my TMS center, where I actually work with a lot of patients with mood disorders, whether it's depression or anxiety, that's one of the things that I'm investigating in those individuals is I'm exploring how are they sleeping? Because I know that poor quality sleep is going to greatly impact their mood. So if I don't address it and ensure that the person is getting an adequate number of hours of sleep, they're actually getting what appears to be good quality sleep, I know that what I'm going to do with them with transcranial magnetic stimulation to help their mood disorder may be blunted to some degree because sleep is an important factor from an emotional response. Well, even a step further, we know that poor quality sleep and sleep deprivation also impacts the neurophysiology of the brain. We know that the brain can't respond as well to a treatment like TMS if it's not getting good quality sleep. So I want to review a clinical study that was actually published just in 2023. It was actually a really phenomenal study. It was a meta-analysis performed in conjunction with the University of Montana and the University of East Anglia that was actually published in the Psychological Bulletin, where they actually did a meta-analysis reviewing clinical research over the last 50 years, so 5 decades, looking at the effect of sleep and emotional response. And it actually included about 5,700 participants over a 50-year time span. And in all the studies that they reviewed, the way the researchers actually kind of affected sleep to be able to judge what's the response from an emotional and mood standpoint included three ways, right? One, they actually had individuals completely sleep deprived, meaning that they forced participants in their studies to not get any sleep at all. Two, they actually had participants maybe stay up an hour or two later than usual. So they kind of sleep deprived them by 1 to 2 hours. And then three, they actually purposely woke the participant up during the study multiple times throughout the night. So they triggered what we call sleep fragmentation. And in essence, what they wanted to see was what impact did it have on emotional response and what impact did it have on anxiety? And what the researchers concluded after a review of this 50 years of clinical studies, they found that all three types of sleep disturbances, whether it was sleep deprivation by a significant amount or even partial sleep deprivation just by staying up 1 to 2 hours later than usual, or disrupted sleep, ultimately all three types of sleep disruption actually resulted in a decrease in the response to positive emotions. So these individuals actually consistently had lower amounts of joy, they had lower amounts of happiness, and they had lower amounts of contentness the next day just by virtue of not getting enough sleep, right? They also concluded through the 50 years of research review that individuals had significantly higher levels of anxiety the next day when they didn't get enough sleep. And it was kind of a dose response um, correlation, meaning that the greater amount of sleep deprivation that the individual or participant had, the greater the amount of next day anxiety. And I've seen that. I mean, and right now I have a patient that's in my TMS clinic from Utah. She's here doing this very intense 1 week TMS treatment for treatment of depression as well as anxiety. And I met with her yesterday in my clinic and I was asking her to see how she was feeling. And she indicated that now, at the start of day four of treatment, she started noticing that her depression symptoms are improving, but she still is having, issues with very broken sleep. And she has a direct correlation that the more broken her sleep is, the higher her anxiety. And it was, that was a very good demonstration of what this meta analysis also proved through all this 50 years of research was that the poor sleep, just as she mentioned to me yesterday in my clinic, she said, when I don't get good quality sleep, my anxiety is at its highest when I wake up in the morning. But when I get better quality sleep or get more sleep, I definitely notice that I don't feel as anxious when I wake in the morning. So this meta-analysis actually showed the same exact thing. And it was very interesting. There's also other research that was published in 2023 that kind of went into the more bidirectional relationship between sleep and mental health. What some of these studies showed that if an individual was sleep deprived, they weren't getting enough REM sleep, which is rapid eye movement sleep or REM sleep. That's where we dream. So what they found was when an individual was sleep deprived, whether it was because the sleep was broken, meaning very fragmented or waking up a lot throughout the night, or the individual was sleep deprived, or the individual just stayed up an hour or two later than usual, but still woke up at the same time the next day, all three of these matters actually result in the brain not being able to get enough time spent in REM sleep. And just by definition, 20% of total sleep time should be spent dreaming. And what research has shown is that when the brain doesn't get enough REM sleep, this actually greatly impacts how the prefrontal cortex, which is the front of our brain, actually responds to emotional stressors. So, research has shown that if a person is not getting enough REM sleep, this in turn actually results in a greater focus on negative emotions and basically overseeing or overlooking, not on purpose, but overlooking positive emotions. So what they were getting at is that people that don't get enough REM sleep have a tendency to focus on negative things far more, and they have a tendency to not recognize positive things, right? So think about it. Obviously, when we're sleep deprived, we have a tendency to focus on just the negative things in life, and we kind of overlook or glance over, not on purpose, like I said, but the positive things. But the other thing they also had discovered as well is that when a person is not getting enough REM sleep, this also affects the amygdala in the brain, right? And this section of the brain also is responsible for how we react to things. So what they found was that when people weren't getting enough REM sleep, because of the impact on the amygdala, and the amygdala also communicates with the prefrontal cortex, this actually resulted in greater amounts of irritability and anger, right? So again, goes back to what I said earlier, is that when we're sleep deprived, I think most of us can attest to the fact that we're grumpier the next day, right? And this is a direct, physiologic change that occurs temporarily in the brain between the communication of the amygdala, which is heightened in the setting of not getting enough REM sleep. And this in turn then impacts how our prefrontal cortex responds, right? From an emotional stress standpoint. So all of this is very, very important because it ties in that, hey, poor sleep quality or sleep deprivation or chronic insomnia isn't the sole cause of the individual's depression or anxiety. The depression or anxiety isn't the sole cause of the person's poor sleep, but that the two are actually married together, right? And there's a paradox as well. And I've brought this up to some of my patients in my TMS clinic and even my sleep clinic, in that one of the detrimental effects of antidepressants like SSRIs or SNRIs is that they actually can suppress the brain's ability to get into REM sleep, right? So that's a paradox, because here we are prescribing individuals with anxiety or depression an antidepressant, but yet that antidepressant has a negative side effect of chemically suppressing the brain's ability to get into REM. And it happens by inhibiting the neurotransmitters in the brain that trigger the brain to go into REM sleep. So it's unfortunate because it may result in some improvements in mood, but yet it actually affects our quality of sleep, which in turn also impacts our mood. So could that be a potential, missing link in terms of why there's a high failure rate of antidepressants, right? There was a trial published in 2016 called the STAR-D trial, D for drug. And what that study showed was that the chances of success of achieving remission or at least 50% improvement in depression symptoms was the greatest with the first antidepressant. And according to that study, the chances of achieving this level of success with the first antidepressant was roughly around 40%, right? And what the study showed, that as an individual went to the second, the third, and the fourth antidepressant, if they didn't respond to the earlier ones, that by the time the individual, went to the fourth antidepressant, the chances of achieving at least 50% improvement in depression or remission of depression symptoms by the fourth antidepressant, the chances of success were about 7% or less, right? So basically, there's a significantly reduced chances of responding to antidepressants. Now, my question is, and I don't think anyone has proven this yet, but knowing all this recent research that's come out in the literature in 2023, my question becomes, from a sleep standpoint, and also now, kind of working in the mental health spaces, well, could this rapid decline in effectiveness of antidepressants, could it be partly or largely driven by the fact that antidepressants actually have a negative impact on quality of sleep, in that they can suppress the brain's ability to get into REM sleep, right? So could the lack of REM sleep in individuals taking antidepressants impact how effective the antidepressant will be in improving their depression, right? Because we see this all the time. I see it all the time in my sleep clinic when we're doing sleep studies on patients that are on antidepressants. It's not 100% correlation, so don't mistake me on that, but it's quite frequent. One of the things that we'll see when we're reading the brain activity during a sleep study is we'll see that the REM latency, which is the amount of time that it took the brain to enter into the first REM sleep, is actually significantly prolonged, right? Normally, it should take us no more than about 90 to 120 minutes to get into our first episode of REM sleep. And we should typically have about 4 to 5 episodes of REM sleep in a typical 7 to 8 hour sleep window. And each cycle kind of repeats itself every 90 to 120 minutes. As the night goes on, the length of the REM cycle progressively increases, with our longest REM period being within 2 hours of our habitual wake time. during a sleep study, the formal sleep study, when a person spends a night in our sleep lab, I'll see a person on antidepressants may not enter into their first REM period until 3 hours into the night. And then they end up only being able to spend maybe 5 or 10% of the total time sleeping in REM sleep, where normal is going to be spending about 20 to 25% of each time sleeping in REM sleep. Right? So again, it goes back to, are antidepressants always doing good for us? There's a value in them, of course, right? But then my question becomes is, well, are some individuals not responding to antidepressants because the antidepressant itself truly isn't impactful? It's not having a positive effect on the mood? Or is it because of the byproduct of antidepressants suppressing the brain's ability to get into REM sleep, which in turn, the poor quality sleep is actually affecting the prefrontal cortex, as I mentioned earlier, which is causing the individual to focus more on negative emotional states, and in turn is not allowing the individual to respond to positive emotions such as joy, happiness, and contentment. So that is a big question for me. The unfortunate thing is that as of right now, we don't have anything that can allow us to increase the amount of time the brain spends in REM sleep, right? I think that could be a really good area of research of, is there something that we could create, whether it's a medication or even, a novel device that we could stimulate the brain externally, like vagal nerve stimulation, which may increase the amount of brain's ability to get into REM sleep. Could we pair this with antidepressants in individuals with anxiety and or depression to be able to promote the brain's ability to get into REM sleep while the antidepressant works on serotonin, norepinephrine, and all those neurotransmitters to improve mood, right? So if we treat a patient with depression, both from the traditional psychiatry route of using an antidepressant to improve the chemical dysfunction, but then we also improve the quality of sleep by allowing the brain to get into more REM sleep. Could this combination approach result in a greater response to these individuals, right? I don't have an answer for that, but it's something that I've been definitely questioning. And I really do firmly believe that the two are very, very linked together. I just wish we actually had a way to increase the brain's ability to get into REM. But point being is that overall, research is showing that if a person is not getting enough sleep, and we know from research back from 2014 and 2016 that in the United States, that 30% of adults and up to 90% of teens are not getting enough sleep as per what's required per their age, that this is going to impact their mood, right? And this then leads to the next question of the unfortunate tragedies that we're seeing in schools with all these school shootings. We're learning that most of these shooters have mental health issues, right? What if we were looking at their sleep as well? Should we be more proactive in schools in including a sleep assessment in all of the children that are in school, confirming that the children are actually getting adequate amounts of sleep per night? Because I see it in my sleep clinic all the time when we see pediatric cases that parents have no clue how much sleep their child should be getting. Most of the times, parents seem to think that the child needs as much sleep as they do, which is 6 to 8 hours per night. But in reality, children need much more sleep than that. A child actually does not progress to a 7 to 8 hour sleep window requirement until they're probably closer to about 20 years of age, right? So think about that. If you think that your 4 or 5 year old only needs 7 hours of sleep per night, they're actually sleep deprived by an average of about 3 to 6 hours compared to what's required for their age. And I'll leave you with this. One of the things that I have focused on in my child, I have a 5 year old son. Ironically, my wife, aptly made me in charge of his sleep because obviously when he was born, I was, working a lot in clinic and coming home very late. And she said that, well, because you don't get to spend much time with him during the daytime because you're at work all day long, your time with our son is going to be at night after dinner, getting him down for sleep, or even before we, go to have dinner. I want you to be able to spend time with him, and I want you to be able to get him down every night. And in the beginning, it was frustrating because, trying to get a baby to sleep that can't understand what you're saying and respond to you was challenging. I admit. But I made it a mission, knowing what I know about sleep and mental health and the importance of quality of sleep, that I always had a very consistent and strict schedule for him. And I have always followed what we recommend in sleep medicine in terms of the number of hours sleep. Like my son is now 5 years old. I still pretty much every night do the same exact routine as I did when he was a baby. So he knows when it's time to go to bed. I foster all those cues, but I always make sure that he gets at least now at his age, he needs 10 to 13 hours of sleep for 24 hours, including naps. Kid stopped napping at the age of 2, but that was because he was getting plenty of sleep at night, so he didn't have to nap during the day, right? But he gets at least 10 to 11 hours of sleep per night consistently and good quality sleep. But I know that if he doesn't get enough sleep, it's going to be a little bit of a nightmare for my wife and I the next day because he's going to be grumpy and irritable. So I hope this was helpful in very important that whether you're a child, a teen, an adolescent, or an adult, that you have to get plenty of sleep. It has a great impact not only on brain health and cardiovascular disease, weight control, but it has a major, major impact on our mood, which in turn has a great impact in terms of how we function the next day, our social interactions, how we perform in school, how we perform at work, how we, form memories as well. So please, please, please get plenty of sleep. If you're having concerns that, hey, I'm not getting enough sleep compared to what's needed for my age, take a look and see, is there something you can change in your routine to improve it? If you still are at a loss, go seek out a sleep physician and get professional help to figure out how do I improve my sleep so I can actually, live a healthier and better life.